Hello. Excuse me. We are live here with the Medicare space on a fun Friday with Sylvia Toscano. And
Hello, San Antonio.
what is going on? Say hi to the camera.
Hi.
This is our first fun Friday that we're going to be doing. Sylvia and I are going to be doing a show every Friday morning at 10 a.m. Where in the future you'll be able to call in, ask questions. We really want to address specifically Medicare, but we could talk about just whatever you want. We're located here in San Antonio. And what we want to do is we just want to address things out there in the community, right? We want to talk about Medicare. We want to talk about insurance. We want to talk about, I could hear your little thing that you're messing with. We want to talk about a lot of different things. Hey, Valerie, how's it going? We want to talk about anything that you guys want to talk about. I mean, we specifically with the Medicare space. I mean, we're Medicare agents, but it's so boring to always talk about Medicare, right? But we do want to address the questions for anybody that's listening about anything. So today, I think, what do we want to talk about today, Sylvia?
Let's see. Let's talk about caregivers.
Caregivers, that's a good one.
It's a big thing. For instance, our parents. My parents, my mom is on Medicare, and I have no idea what plan she was on.
Yeah.
If I have to take her to the doctor, I don't know what plan she's on. I don't know what her copays are. I don't know who her primary doctor is.
Yeah.
And there's a lot of children out there, kids that or grandkids, like my daughter, who's the one that's responsible for my mom. They're taking their parents to the doctor, to the hospital, to get glasses, dental, taking advantage of the benefits they have, but they don't know what insurance their parents have. So first of all, I would like everybody to take out their mother's card, their insurance card, and take a picture of it in case they lose it.
Yep.
Make sure that the primary doctor their mother wants to go to, or their dad, their parents, is the one on the card.
Yeah, that's a good one.
Take a picture of the bag, because if you lose the card, you have no idea who you're going to call. You're thinking, my parents are in plan G or F or whatever plan, and you're going to Google that, and there's going to be 1-800 numbers. So if you have a picture of it, you know exactly who to call.
Yep.
Also, find out who the agent was that helped your parents. Take a picture of their card. So if there's any issues with their insurance, or you're not sure what I lost my train of thought. What benefits they have, you can call the agent. That's what agents are there for.
Some agents, because
some agents, but the good agents are there for the parents, for their clients all year long.
Yeah.
I have a lot of clients. Yesterday, I had a client calling me because they couldn't get referrals. And I know some agents think, call the doctor. But as an agent, that's what I'm there for. I'm not just going to sign you and just let you go. I'm there for the whole year if you have any issues.
Yep.
And it's not easy. It's not hard to have somebody call me and tell me I've lost my card and do a 3-way call with the insurance. It takes 5-10 minutes.
Yeah.
And in the meantime, you have that relationship with your client that we all should have. If I had a regular business, whether a restaurant or a construction, I would have that relationship with my clients. So why can't I have it with my clients with the insurance?
Yeah. Well, I mean, that's what we are here, especially the independent agents, because a lot of people that are watching might not know the difference between an independent agent versus somebody that's working for a company. So either one that you're working with, whether you're the daughter, the son, the person that actually is the person that's insured, anybody that you're calling, you want to make sure that you do build that relationship, like Sylvia said, and also know that we do get busy too.
Right.
We can't always be available, right? As much as I would love just to have my phone next to me all the time, I mean, there's times where we can't answer our phone, we can't get to our messages, and so that's why, like Sylvia said, it's important for you guys to carry that insurance card, because in back of the insurance card, you'll see something that says member services or customer service. Not only do you get the service of us, right? Kind of like the feet on the streets, But there's also member services specifically designed to help you with anything about your insurance plan, whether it's over-the-counter questions, provider questions, there's a whole bunch of things that we could talk about when it comes to insurance, but we're just kind of an extension of your insurance company. But like I said, if for some reason we can't answer, you always want to get a hold of the insurance company. What I would say too, is you were talking about the caretakers and how they should take a picture of the insurance card. But what happens if they're not primary, beneficiary or something along those lines?
Right. And that's a really,
I think we hear somebody vacuuming in the background.
I'm going to send them to my house after that. Yes. So what happens is somebody's in the hospital, your parents, they're in the hospital. And of course, the doctor or the hospital wants to know what insurance they have and they can't find it. You can call and just say, send me my mother's card.
Nope.
So I suggest that everyone today or Monday, call the insurance and put yourself down as a
authorized representative.
Authorized representative. So like that, if you have any questions on your mother's plan, if they lose the card, you can call and replace it.
Yeah.
Yep.
And I would even say, it's, a lot of us out there, and I'm guilty of this, because my mom still takes care of her stuff on her own, but for the most part, we should be more involved. But for people that are out there that have parents that are getting to the age of maybe Medicare, or even before that, but at the age of Medicare, try to be more involved in the process, because you just never know when you're going to need that information. And it's very frustrating. God forbid something happens, right? We're like, well, what's the insurance? Who's the insurance? What's the first thing when you go to the hospital or the emergency room? What's the first thing they ask you for?
Insurance card.
Where's your insurance card?
Right.
And if you're the person that's taking your mom or your dad or your aunt or your uncle or your cousin or your friend, and you're kind of not involved in the process, well, we're just kind of going in there blind. We have to rely on the person that's being hospitalized or that's sick, right?
And if they're unable to talk,
oh yeah,
that's a big thing. If something happens, if they're worst case scenario, if they're in an accident, they might send them to a different hospital.
Yeah.
Might not be in network, even though all of the insurance accept emergency. But you never know where you're going to be and what's going to happen and what insurance you have. So very important that you get involved in your parents' insurance plan, that you know what their benefits are.
Yep.
And that you take advantage of the benefits. A lot of insurance give you benefits for glasses and dental, gym membership. I know nobody's going to the gym right now, but things like that. They give you a catalog for over the counter. So take advantage of those. I hear a lot of my clients tell me, well, I don't need the over the counter.
Yeah.
But you know what? At this point, with everything going on, people's finances being really hit, take advantage and buy those over the counter. Put them together in a little Goodwill basket and take them down to the church or your neighbor or somebody. It's part of your insurance. It's at zero cost. Take advantage of everything. I talk to a lot of, when I see them at the clinic or wherever I'm working at, and I ask their kids, do you know your parents have this benefit or that benefit? And they have no idea.
Yeah.
They don't know how much their copay is going to be if they go in the hospital or a specialist, or if they need an MRI or a CAT scan. And then when they get the bill, they're like, oh my God, I thought the insurance covered everything, because a lot of people think Medicare covers everything. And when it doesn't, and they get a bill, their kids are like, wait a minute, why are we getting this bill? Do we have to pay it? I thought Medicare was going to cover it.
Yeah.
And that's another thing. If they have a regular insurance, sometimes they're thinking Medicare is covering it. Well, they don't realize that now the insurance is their primary. So they have Medicare and their insurance is their primary. Every time they go to the doctor, the hospital, get the prescription, that's what they're going to give them, not the Medicare card. And that's where a lot of confusion comes in, especially if you were not there when they signed your parents up.
Exactly.
Now you're like, wait a minute, then why does she have this red, white, and blue card? And why does she have this? And nobody's paying.
And sometimes they carry their old insurance card. So they have
Oh
like
my
5 or
God.
6 different, you're like, XYZ company, what are all these? I don't know why do you think people like to say
they don't want to. I was at an HEB and I was talking to a client that stopped by. She had 8 different cards.
Oh my God.
From like 20, no, one of them was like 1997. I'm thinking, what are you doing with this card? On the back of the card, it has a year. And so I told her, okay, this is your card. Throw away all this. No, but what if I go back to that insurance? It's like they're going to assign you a new number, but you have all this. And that's why your doctor's like, no, you can't come here because you're giving them the wrong card.
Yeah. Yeah.
And there's, you go to the pharmacy to get your prescription and you're giving them the wrong card. They have no way of looking in the system, looking under your Medicare number or your social and figuring out what insurance you have.
Medicare used to make it easy for us agents and especially the beneficiary to go into the Medicare system and without having to log in and having to create an account. We used to be able to check enrollment on what type of Medicare plan you had, if it was a Medicare Advantage or a prescription drug plan. And so that made it really easy for us to find out exactly what you were on. Well, they've kind of made that process a little harder.
Yes.
Now you have to create a Medicare account.
Right.
Now.
And a lot of seniors don't have a computer. They don't know how to get on the internet. And so they rely on us to help them get an account, give them their password.
I'm going to go to Medicare.gov. You can go ahead.
Okay.
Yeah.
So if somebody comes to me and gives me 4 or 5 cards, yes, we can look under Medicare.gov and find out. But we're going to have to get them an account. We're going to have to give them a password.
Yeah.
And that will tell them exactly what the plan are, what your benefits. It gives you all the information. Yeah. But if they don't know, they're not going to go under Medicare.gov.
Nope.
Not a lot of people have an account with Medicare.
Yeah, because it's just one other thing you have to do.
Yeah.
Like you already have to remember your insurance, your bills, your CPS, your water, your phone bill, your car insurance, your home insurance, and then to have that one more step. But it is important. Like I'm not taking away the importance of having these accounts, but I'm also saying you should probably, they shouldn't make things harder. I hate when they make things harder. I'm sorry, but I'm sorry when they make things harder for our clients because it only makes it harder for us to serve our clients in an easier way. But to that though, however, I would say that I'm going to share this to my other page. I will say that technology is making things a lot easier. So I can complain about this other side, but I still have to say, okay, well, there are things that are helping our clients a little bit easy, our lives to help them a little bit easier.
Right.
Like helping them enroll over the phone now, helping them enroll through email, through text. So there's a lot of great resources that we're going to be talking about in the future. Let me share this. Anything else you want to add on some of maybe the issues that seniors are facing right now, like kind of in this situation?
Well, one of the biggest issues right now is face-to-face. I get a lot of calls from my clients, or even when I run into them, that tell me, I haven't seen my doctor and they don't want to see me. And I tell them, it's not that they don't want to see you. It's that they're taking all the precautions to keep you safe, and the staff and the doctor, the primary. Everybody wants to stay safe right now. Everybody's wearing a mask. Everybody's staying 6 feet apart. So I explained to them that it's not that your doctor does not want to see you, is that right now, unless you really need to see the doctor, you're very ill, they're not going to see you do a face-to-face.
Yeah.
So, which is good, you know. Hopefully you're healthy. You don't have to see the doctor. You're not sick. But in the event you are and you have to see him, of course, they're gonna bring you in. But a lot of people just have regular 3 months checkup or 6 months. They're not having that anymore. And so I tell them you will eventually see your doctor when they open everything back up, when all the doctors are going to have regular appointments. You know, I mean, we've come so far. A couple of months, people were waiting in their car. The nurses were going out there, taking their temperatures and then letting them in one by one.
Yeah.
Little by little, they're going to start letting them wait in the waiting room, which they're doing now. So eventually everything will go back to normal, but it's kind of baby steps.
Well, I have to give credit to, man, you know, I have to give credit to all of the people that are in the medical field, nurses, the nursing assistants, the doctors, the staff. I mean, just from start to finish, because being able to transition from what we dealt with to like now and everything that they had to go through. I mean, I recently was in a hospital, not myself, but a friend, and I was in the hospital very much, you know, a week at a time or more. And I'm just like, wow, like they actually have their stuff together, you know, considering all things considered. And so if anybody's in the medical field, you know, kudos to you guys, because you guys have a hard job. We get to sit back and do this.
Yep.
You know, and our job is hard too sometimes because we do, you know, we're out in the streets a lot. But man, that is another level of care.
Yes.
That I have to give it up to those people, because man, I couldn't do it.
And they've adapted to it, and they're doing an awesome job. I mean, I work with several clinics and they have done an amazing job staying safe, keeping their clients safe. I was at a particular clinic this week, and they've got the temperature and it's mounted to the wall, and all you have to do is go up to it, stand about this close, and it reads your temperature. And I was like, oh my God, this is so cool.
Sylvia's like this.
I was like, if I stand over here, and so you're not touching it, they're not touching you, no one's coming up to you, because what happens if you do have a fever? You've got a nurse going up to you, taking your temperature, and you're at 101. So at this point, if you are at 101, get out. Leave. No, they wouldn't tell you that. But I mean, they're taking all the precautions, you know?
Yeah.
I mean, they're doing a great job. And so we should applaud them, everybody in the medical field, for doing an awesome job. We work with some great clinics, all different kinds of clinics all over San Antonio. And
yeah, I have to give a shout out to, I won't name any particular names, but we do work, like you said, we work with a lot of local clinics. You know, I will, like Health Texas has always been really, really good with our clients. You know, you have Gonzabas and WellMeds and Conviva and all the other one. Am I missing anyone locally here in San Antonio?
Bandera.
There's a lot of, if I missed
doctors.
you, trust me, we want to thank you. But, you know, going back to that, because you were talking about how our clients are, they're probably not getting as the care that they need because they're scared to get out there and stuff like that. But we have to tell them, because there's a lot of things within their plan that they could take advantage of, like virtual doctor visits, telemedicine. And a lot of times people don't take advantage of it because it's such a new type of service that they're not used to. You know, they're used to sitting by the doctor's at their bedside, talking to them, chit-chatting, how's the family, how are your medications? So they're used to all that, but there's still an extension of that you can get through the plan, as long as you know how to use the plan. And so that's why we wanted to create this kind of live show every Friday, just to let you guys know. Thank you so much for you guys that are listening in today. I see some of you are chiming in. Thank you. Josie says, great info, ladies. Valerie says, what's up? So we just want to thank everybody for joining in. Share the show. We are going to be doing this. We're going to try to do it every Friday at 10 a.m. Today we were a little late because we were chatting amongst ourselves.
Eating tacos,
which we probably need to lay off the tacos already.
We blame Corona for our gangway.
I know.
We blame the storm.
Yeah.
So hopefully That's it. No more.
I blame Sylvia for bringing me tacos.
Another thing, when you were saying the majority of the plans, pretty much all the plans have everybody seen the commercial, I've fallen and I can't get up.
Oh, yeah.
Especially at this time where a lot of people are not going anymore.
Oops, sorry, that was me.
Oh, a lot of people are not going out. They're staying at home. I know some of my neighbors, their kids don't go over there and visit them. So they're pretty much isolated.
Yeah.
Well, all the plans, I should say, all the plans have that I've fallen and I can't get up.
Yeah.
So you either get a bracelet and a necklace.
Uh-huh.
So in the event you fall, something happens, it will alert EMS. You don't need the internet. Some of the people say, well, I'm pretty healthy. I never fall. Everybody says that.
Yeah.
I say that.
I just told Carmenza last night that I was like, we need to, because we have the 2-story and all of our floors are wood, right? And so when I come down with my stairs, there's been a few times where I've been scared. I'm like, oh my God. So I was like, we need to put a carpet there. But I'm like, oh man, I think I need one of those, what do you call the purr system?
Yes.
Because I'm like, our seniors people don't want to feel like they're getting old. Nobody wants to feel like they're
feel like if I'm getting old, but we are, and it's just part of life. And I tell them when they tell me, oh, I never fall, I'm pretty healthy.
Yeah.
Well, then get it anyway. Put it in the shower, because more than likely, that might be 80% of the time where people are going to fall and slip. And if you do, it's right there, and you can alert the emergency and they'll call. They'll go by and see if you're okay. They'll notify your family. Yeah. And so you're not isolated. Even if you are, you've got help if something happens to you. A lot of my seniors are out there working in the yard. Spring is coming, and it's so easy to be working out in the yard and falling down. Yeah. And then you don't, your neighbors might not hear you. If you have that life alert on you, you call it, and somebody's there. They notify your children at work or wherever they are. So there's a lot of benefits out there that people are not aware of. And that's what we're going to try to bring in the next couple of weeks. Every Friday, we're going to be here. And if you have questions, how can they let us know?
So right now I have a live feed going on. I have where I actually have on the screen, ask questions now. Sylvia can't see my screen, unfortunately, because I'm trying to manage it from the background. But I've put where they can answer questions. We have a live chat where if you guys have questions, put it in the comments, because I can see the comments right now. Put it in the comments. We'd love to answer your question. This is meant to be interactive. There's only so much me and Sylvia can talk about, otherwise you'll have to get us a beer or something, because then we can really be chatty Cathy.
Some whiskey.
So any questions that you have, put it in the chat. If you, what we're going to be doing, we're going to be implementing live calls, like radio stations where you can call in and ask your questions, tell us your concerns. We want to address anything you might have. I mean, we could think of a long list of items that we can talk about, but we really want to narrow it down. Probably every week we should probably narrow it down to specific topics. Today, this is our first show. We haven't even decided what we wanted to call our show, maybe Fun Fridays or Fabulous Friday. I don't know. Something where we don't just talk about Medicare, right? But we talk about, we address a lot of the things that are going on in the community for our seniors that are not just on Medicare, but maybe in that 55 and up range even. Shoot, I mean,
what's going to happen when I turn 65?
Yeah, what's going to
Social Security? How does Social Security play a part in the Medicare? A lot of people think Social Security and Medicare are the same thing, and they're not. They're completely different. They're not the same. And a lot of people think, oh, I'm going to get Medicare automatically, or I'm going to get my Social Security, and they don't realize that, or they're still working and they don't know that they have to apply for Social Security to get the Medicare or pay Medicare with a check. And so providers, they don't know, if their parents are ill and they have no one to take care of them, but they don't qualify for Medicaid. There's still help out there. So a lot of these questions that you might think, I got to figure out how to help my parents a little bit more. That's what we're here for.
Yeah.
Yeah. Ask the questions. And if we can't answer them right then and there, we will find them. We'll Google them, Google it like everybody else.
We have the computer right here.
We have a computer here. So whatever you have, whatever questions you have,
Yeah.
we'll figure out a way to find an answer to get you the help you might need.
What's your phone number, Sylvia?
210.
Hold on. Let me, I'm going to put Sylvia's number up here. So that way, if anybody on her channel is listening and they have questions, let's see. Is it okay if I put it out here?
Of course.
Okay. 210.
878-9534.
953. I should have this memorized by now. Call
Always
Sylvia.
asking me.
Call Sylvia.
But then again, how many of us knows any number? I only know my brother's phone number. So if something happens to my phone,
if I get locked up, I can't even call my mom.
I know. ICE. In case. What does ICE stand for?
ICE?
Yes.
I don't know.
In case of emergency.
Oh, in case of emergency.
So everybody, I just found this out on your phone. You need to put somebody, like on my daughter, I have her down as ICE, Stephanie. So if I'm involved in an accident and they find my phone, who are they going to call? I have literally 100 contacts on my phone.
That's not very many.
And they're pretty much all my clients.
You have more than that. Yeah, you
probably have more than that. But if I'm in an accident and they find my phone and they want to call my family, how are they going to know who to call?
They're going to call one of your Medicare clients.
Exactly.
They're going to be like, hola, Sylvia.
So the police can look at your phone under ICE and they're going to call that number because that's your emergency contact.
I didn't know that.
Yes.
That's a good tip. So write that down.
Yes.
If you didn't know that, if you want your emergency contact, maybe put like Mom ICE.
Right.
Not like ice baby. Dun, dun, dun.
You don't want to hear us sing.
Oh my goodness. So, like I said, guys, on this show, we're going to be chit-chatting, but we really want to address topics for the seniors in our community, whether it be in San Antonio or anywhere in Texas and nationwide eventually when we start reaching more of our customers that are out of state. But a lot of you guys that are listening are probably in the San Antonio, Texas area. So any questions that you have, if we can't find it, like Sylvia said, if we can't find it, if we can't find it, we will find the answer.
Right.
And we have our nice little, we're going to be like Vanna White here, our nice little TV where we can show you and to teach you on how to, like right now we're at the Medicare account login. I wanted to show them this real quick because if you're on Medicare and you want to go in there and find, let me get my mouse over here. If you want to go in there and find what plan you have, if you don't want to wait on Medicare's hotline, right? Sometimes it could be 30 minutes that we're waiting. Sometimes you get lucky, you get in right away. But if you don't already have a login and you're on Medicare, you don't need an email address. All you need is your Medicare number, your date of birth, your name, obviously. You're going to want to create an account right here.
And Medicare won't give them their Medicare number.
Yeah, they will.
They will now?
Yeah, they will. But they have to give them their social, their date of birth.
Okay.
Yeah. And when you call Medicare, I'm just going to break this down for them. When you call Medicare, and for those of you that are listening that are on Medicare, that red, white, and blue card, when they call Medicare now, they're going to get one agent. And that agent's going to say, what's your social? What's your date of birth? If you want the Medicare number, right? They're going to ask them all that. And then guess what? Okay, I'm going to transfer you now to a tier 2 agent.
Oh my God.
So they got a way to get, and then that person's going to re-verify their information. And then that second agent's going to give them their,
okay.
So there's like a 2-level process. So for those of you agents that are listening, that are trying to help your clients, they have to be on a 3-way call. And that, or even if you're a family member that's doing this for parents, you will have to be on the phone with them. They'll have to be there with you. And they're going to actually ask that individual if they can actually speak with you.
Right.
And they're going to need to get permission.
Right.
So that's why it's very important, like, to have the most all this information in a very safe place. And if you guys want to, let me go back here. If you guys want to enroll and create an account, you're going to need that Medicare number, and you're going to need your Part A or B effective dates, depending on. And then when you put that information in, it's going to then ask you to create username and password. Pick something easy so that way you can remember your username.
So when they call and get the Medicare, don't forget the Part A and Part B effective date.
Yes.
Because if not, you're going to be like, oh my God, I don't have it. It's when you turn 65. But you might not remember that when you turn 65, or maybe you got your Medicare because of a disability.
Yeah.
And so you're younger than 65. So if you do call them, make sure you ask them when the Part A and the Part B start.
So Josie Cabrera, we all know who that is. She says, wow, this is great information. I'm going to turn on my live notification. So thank you for reminding me, guys. If you're listening in, or if you listen to this recording later, be sure to subscribe or follow us at Sylvia Toscano Medicare Insurance Agent, I believe it is. And then mine is the Medicare Space. Go ahead and like our pages, because then what'll happen is you'll be able to see our live, but don't forget to hit live notifications, because that's going to allow you to get these, when we do live videos, it's going to allow you to see our video right away. But if you just write this down, every Friday at 10 a.m., right? We're really going to try, because when we're on vacation, we got to take some time off here and there. But for the most part, we're really going to try to be here every Friday at 10 a.m.
Right. And if there's a topic that you feel is important to you, pertaining to seniors or your parents, and we haven't talked about it, or you think it's important, then call us, email us, text us, let us know, if we skip something. We will try to stick to one topic a day or every Friday, because there's so much to go over. I mean, we'll be here endless days and nights if we go straight to Medicare and just go over everything.
Exactly.
So we're trying to break things up by week. And if you want to talk specifically about something or information, just let us know. Yep. And we'll do all the homework for you.
Yeah. And also, I think we should make some days, we want to try to make it fun and interactive,
right?
Especially interactive, because we love the engagement. And so maybe we could do little raffles.
I love raffles.
We could do little raffles. So you don't have to be of Medicare to win the raffle. It's just by engaging in our community. What should we do next week? We should do something.
That would be good, a raffle, because the senior centers are all closed. Nobody's playing bingo. Nobody's participating in anything. So we can participate in this.
Yeah. I'm wondering. So we're going to come up with a giveaway next week. And we'll probably do one or two, just to make it, fun. And like I said, you don't have to be on Medicare to win a prize. You can be of any age. It doesn't matter, as long as you're engaging with us. Comment, like it, share it. That's the only way that this information is going to get out to you guys.
Right.
We're going to be, this is our first show. So our first live stream with the Medicare Space. Sylvia, she acts nervous,
I'm a little nervous.
And so we'll be a little bit more structured next time. Today, we were kind of just all over the place, just because we, this is our first deal with you guys, but we don't want to be so scripted either. Right. I mean, it's kind of boring when it's Part A
and Part B, because we have these meetings when we do Medicare 101s, and I always try to make it fun and entertaining. And when I go to my client's house to talk to them about Medicare, they always tell me, not that I'm bragging or anything, I finally understand it. Yeah. Because I tell them I'm going to do a Medicare 101. I'm going to explain to you how Medicare works.
Yeah.
Because a lot of times people go to their house and hear sign this and they're out the door.
Yeah.
And so I try to educate them. And that's what we're trying to do here.
Yep.
Educate you in a fun way where when it's over, you're like, I didn't know that, or I'm going to have to ask them this. And it'll snowball, where we have a lot of people, everybody's calling, but we have to start somewhere. So today's our first day.
Well, And I want to thank Sylvia for, this was Sylvia's idea, doing the live show. I'm just kind of being a participant. So if you guys have any questions, concerns, you want to chit chat about Fiesta and how it might not happen in San Antonio.
I know, no more Fiesta. Next year, maybe.
Yeah.
We used to do the Paella Festival.
Oh,
Another
I'm
one.
so sad. I love the Paella Fest.
I know. There's some great restaurants here.
Yeah.
We go. Can we say where we go?
Yeah.
El Toro.
Oh, Toro. Yes, I love Toro.
If you missed the Paella Festival, well, not missed it, but because we didn't have it, and you want some great paella, they've got the best paella in San Antonio.
Yeah, if you're in San Antonio and you want some paella, you want a little glass of wine, some tapas, Toro. I personally like the downtown location.
Yes, I do too.
Because we live downtown and it's just close to us. I haven't yet been at the one up at the north side or up north. I don't know where it's at. I think it's in Stone Oak. But yeah, I'm going to miss Paella Fest, but I understand, with everything going on, but I'm going to miss it because I love. So next year, if Paella Fest is happening, you guys should go out there. It's awesome. It's an awesome, fun, it's not that jam-packed like most Fiesta events.
And maybe
right?
we could even be out there and do a little, what we're doing here.
A little show.
Yeah.
See, Sylvia has all the ideas. I'm just the one that works on the back end
So you could see us live.
Yeah.
Live in San Antonio.
Dude, at the Paella Fest. Welcome. And then we're going to be playing the little guitar.
Yes.
So guys, next week, we're going to be here at 10 o'clock. So be sure to join in next week on Friday at 10 a.m. Every Friday at 10 a.m. as much as we can. We want to get the community involved. Questions about Medicare, questions about insurance. If you have somebody that you're helping with their insurance, maybe you're, taking care of their parents, uncles, aunts. We are a resource that you can take advantage of. If you can't reach us here, let me put Sylvia's number.
Even providers. I mean, if your parents or Medicaid and they have somebody going over there and helping them and they have no other family members.
Yep.
Even those providers, they also need to know the person they're taking care of.
Absolutely.
If something happens on their watch, what are they going to do? Who are they going to call? Not Ghostbusters.
Ghostbusters.
They're going to have to call somebody. And so that's what we're here for.
Yeah, we're here to answer your questions. Guys, this is live. So if you have a question, I see you guys watching, put it in the comments below. We'll put it on the little banner so that way everybody can see the question that you had. And next week, like I said, what we'll do is probably that week prior, we'll post what the topic is going to be about. But we could just kind of talk about whatever we want. I mean, like I said, we just want to be an additional resource. I think you can't ever get enough resources in the community. I love San Antonio. San Antonio is such an awesome Texas. If you agree, hit that like button. If you're in another part of Texas and just put where you're from, if you put it there, we've probably been there. We drive all over. I mean,
Gonzales, I was in Gonzales this annual enrollment. Great town.
Yeah.
Great people out there. I was at the HEB. Everybody's so friendly there. I mean, we're friendly here.
Yeah.
Don't take me wrong, but they're just so friendly there. Victoria, all the little towns in San Antonio, Floresville, Pleasanton. Shout out to all the little towns we've worked at.
Yeah.
Frugalville, I was there.
Frugerville or
Frugerville. Sorry about that. Last year, the year before last?
Pflugerville, yeah.
Frugerville.
Yeah, Georgetown. All my Georgetown people, Austin people. We are here to answer your questions. I used to be a road warrior. Now I'm doing everything, telephonically.
I like the road.
Sylvia's a road warrior. She's just like everywhere. She can't be home. She's the type of
I can. If I'm at home, I start cleaning. I start playing with my dog Will. Shout out to my Will. So I like to be out there. I like to interact. With my clients and help them. And so now we could do it instead of a one-on-one. We could do it on a everyone.
Yeah, yeah, exactly.
It's no longer one-on-one. We're reaching out to the community. And don't think, oh, well, I live out here in Floresville. Is everything still the same over here? Yes, it is. Medicare, Social Security, the insurance, the questions you have in San Antonio might pertain to the ones in Gonzales.
What's up? What's up, Omar? Yeah, so we are, we're just trying to be a resource, and if you are a community partner, with a medical group or maybe a dentist's office, or you feel like you can provide value to our community any type of way, let us know. We'll be happy to have you on. We'll try to squeeze you in somewhere here. We'll make it work. We'll make it work, because the goal is to get the information out to the people that need it.
Right.
And we're just a little fish in a big, big pond or ocean, right? We're at the shrimp level, I think.
What's lower than shrimp?
We're like whatever the shrimp eat. That's what we are right now.
But we're gonna become big dogs.
Yeah, we're gonna be big dogs, and you guys are gonna be like, "Hey, Victoria,
oh my God, that's them." No autographs, please. Not yet.
So, like I said, guys, we're gonna probably end here. My unfortunately, I forgot to charge my battery on my laptop here. So before we end, we want to remind you, every Friday at 10 o'clock, join in. We're going to be talking about random topics, primarily to seniors in our community, but anybody can, when we do the podcast,
because not just seniors are on Medicare.
Oh no. Yeah.
So I've got seniors that are in their 30s,
good 40s, point, Sylvia. Good
50. Point. And so, yes, a lot of it, the majority of the seniors are 65 and older, but there's a lot of them that aren't. And those are the ones I think that aren't as familiar with benefits, because they don't know any other seniors. At least a senior can ask another senior, hey, what benefits do you have?
Yeah.
If you're 30 years old and you have Medicare, you might not know anyone else that has it. And so you're at a loss. Well, we're here for you guys.
Yes. Yes. And good point, because I get so caught up in, we think, oh, Medicare is only for seniors. But again, we want to point out, this is not just for people that are on Medicare. If you're anybody watching, you could take a good nugget away or two. Even if you're an agent watching, you can take something that you could pass on to your clients. And, if we don't know it, like I said, we have so many partners in our community. We will find that answer for you. That's the whole goal.
Right.
So any last things you want to add, Sylvia?
No, just keep watching us.
I'm going to put here, let me go back. I'm going to put here for them to where they can tune in. Let's see, 10 a.m.
Every Friday.
Hopefully. Oh, 10 a.m. every Friday. Check in with us.
And if restaurants, a lot of the restaurants have been hit by Corona severely. I have got some good friends that own restaurant. The Web, one of my favorite restaurants that I go out and eat at least once or twice a week. Any restaurants who want to come by and give a shout out to us, lunch special.
Oh, yeah.
Senior lunch special. I know Jim's does a lot of specials for seniors.
Good idea.
Maybe especially right now, they're opening up slowly. Maybe they have specials for seniors. So on Friday, some restaurant is going to do a special for seniors, 2 for 1, something like that.
That's a good one.
We're not just there for seniors. We're here for San Antonio, for the community. And if we can help the restaurants and the doctors, I've got a great dentist at Brook Hollow that works with seniors. I mean, everybody, let's all work together to make this a successful show on Friday.
Yeah.
We're here for you for whatever you need. Give us a call, text us, email us. Just let us know. And if you see us on the street, don't run us over. Say hi.
That's such a good point, Sylvia. Yes, we want to support our local businesses. We love San Antonio. We love how San Antonio always comes together as a community. I've been here for about 20 years almost. maybe
Born and
like
raised.
19 years. But I love San Antonio. And what I love most is that we always come together as a community, regardless of, and so like Sylvia said, that's a great idea. If you are a restaurant out there that it's looking to offer seniors a good discount, we'll put you guys up. We'll put your information up here. You know, I almost want to do like a raffle for like a little help for a restaurant. Maybe that's a need. Maybe that just needs something like $100 or something just to help them going. Maybe we can do that. Maybe we can do that next time. And so if you have a restaurant that you feel that is in need, that you can use maybe $100, tag them in the next show. Be sure to share share. You know, just because we don't want to just help our seniors, we want to help San Antonio, and
we want to be part of San Antonio.
Yeah,
you know, the bigger part. You know,
bigger part. Yep. Yep. So bringing people together. All right, Sylvia. So I think that's good for today. You know, the shows will probably last about an hour. Today it's going to be about 45 minutes, just because I feel like my computer's going to die here next time. Where my computer's dying, I'll be more prepared next time. But all right, awesome.
That's
high
it.
Five.
High five. Bye, San Antonio.
Bye. See you guys later.
See you.
All right, let me end this here. Don't forget to